Hello there, and welcome to our daily briefing for Friday, January 15th, completing week number 7,922 response. It's been going on for a while, hasn't it? These are a little more on demand now, of course, in the 1, 5, and 8 p.m. hours on the radio and uploaded to youtube.com/Cordova TV. Don't have a guest today, but got a pile of stuff to go over, so we'll just dive right in, and we'll talk mainly about a frequently asked question document the city put out regarding vaccines, because that's on a lot of people's minds, obviously. And then if we have some time, we'll look at some of the state trends, which have tended to be pretty good, but we'll look at some of the highlights in their report. As far as our local cases, they reported a couple additional resident cases on the 13th, both travel-related, and that put the total active case count at 10 for residents, and that's still the case. Looks like 10 active resident cases, 2 active non-resident cases. Again, they were able to bring the city health alert level down to 3, the proceed with caution level. The medical response team continues to strongly advise against all elective travel, because that's going to be the chief vector of, for bringing it in. Clinic times are the same. They won't be doing testing on Monday the 18th, Martin Luther King Jr. Day. Otherwise, it continues to be Alanka Mondays and Fridays from 2 to 3 and Saturdays noon to 1. And at CCMC, Tuesday, Wednesday, Thursday from 9 to 9:30 a.m. And if you have insurance information, please bring that. Again, vaccines are on a lot of people's minds, obviously. The medical facilities in city are getting a lot of questions about it. So they put out a document recently here that we'll go over and hopefully be able to answer a number of questions for a lot of people at once. Question 1, when will Cordovans 65 and older be able to receive the vaccine? The state of Alaska is allocating vaccines throughout the state. Both Alanka and CCMC have requested allotments for the Phase 1B Tier 1 vaccine group, which includes Alaskans 65 and older, but they haven't yet gotten confirmed information about how many or when those vaccines may arrive. Number 2, and there are 6 of these. Number 2, some people in Cordova have already received vaccines. Who and why? Cordova was allotted vaccines for the Phase 1A vaccine group, which included healthcare workers, first responders, and nursing home residents. Almost all of that group has now been vaccinated, and we're ready to move into Phase 1B Tier 1. There were a very few vaccines left over from the Phase 1 allotment that were administered to the most medically high-risk Cordovans from the Phase B Tier 1 or Phase 1B Tier 1 vaccine group. Again, that's largely 65 plus. Question 3, who decides which communities and or groups get vaccines? Vaccine allocation is determined by several sources: the state of Alaska, Indian Health Services, Veterans Administration, and the U.S. military. Cordova has received an allocation from Indian Health Services that can be distributed as the local tribal council determines, as well as its state allocation for Phase 1A. Question 4, why can't we put our names on a list or schedule to be vaccinated when Cordova receives its next allotment? The answer to that is the team doesn't know when or how many vaccines they'll receive, because the state controls that. The 2 types of vaccines we've received in Cordova so far both have time and temperature sensitivities. The COVID vaccine is not like the flu vaccine. There's a limited time window to administer it for it to be effective, and 2 doses are needed for optimum immunity. Therefore, patients must be able to receive their dose as soon as it's ready, as well as ensure they'll be available for the follow-up dose. Question 5, which vaccines are available? The Pfizer vaccine, which was in CCMC's Phase 1A allotment, held in Anchorage and shipped in varying order sizes to Cordova refrigerated. We have 5 days from the moment it leaves the freezer in Anchorage to administer the vaccine. The vial needs to be warmed to room temperature and diluted. Then it must be administered within 6 hours. Most vials have 5 to 6 doses. The second dose is given 3 weeks after the first. Moderna vaccine, which was the Elanca December allotment, shipping to Cordova in 100-dose shipments directly from the manufacturer. That vaccine can be maintained frozen for 6 months or in the refrigerator for 30 days. The vial needs to be warmed to room temperature and must be administered within 6 hours. Most vials have 10 to 11 doses, and the second dose is given 4 weeks after the first. Then question 6, the last one here, what can I do to prepare? Answer is decide if you want the vaccine and be ready to be flexible. We'll get the word out as soon as this again from the city and the medical team. We'll get the word out as soon as we know when and how much vaccine Cordova will receive. We want to vaccinate as many people who are eligible per state guidelines as possible, and we'll give details at the time of the announcement. Once scheduled, please show up to those appointments on time to ensure that no vaccines are wasted. And then they conclude by saying, we appreciate the interest in the COVID vaccine. As soon as we have more information, we'll distribute it through multiple media platforms. Please bear with us as things may rapidly change. Your medical community is working extremely hard to provide vaccines for all community members. If this vaccination process were in our control, we would give a vaccine to every Cordovan who wanted one tomorrow. Please be patient as we work to provide the vaccine and be assured we're doing everything in our power to ensure that there are vaccines available. And this document, by the way, if you want to read it, I'm pretty sure is on the city's COVID19.cityofcordova.net site, and I also recall Heather putting it on the Facebook page, the city's Cordova Prepared Facebook page. How are we doing on time? I think, we can get some of this state information in. And the data from the state has been improving. In this latest weekly report, they said the daily growth rate of viral transmission in Alaska reversed from a positive 0.26% to a negative 4.2% during December, indicating a general downward trajectory during that time period. Although, unfortunately, in the last week, the trajectory flattened out and the growth rate increased to minus 2.8%, which raises concern for an uptick. They emphasize that every Alaskan who chooses to wear a mask, stay 6 feet away, and avoid indoor gatherings contributes to the response effort. The statewide effort to provide every Alaskan with the option of receiving a vaccine as soon as supply allows is ongoing. 2 vaccines for COVID-19 have received FDA emergency use authorization and are currently being distributed. There's some information, and this website link, by the way, if for the specifics on the vaccines, what phase they're in and all of that. I won't do all of that here, but go to covidvax.alaska.gov. That's covidvax.alaska.gov, and you can see what these different phases and tiers are. This report mentions several new variants of the virus causing COVID-19 have been reported, including the one in the United Kingdom. There's one in South Africa, one from Brazil. The UK variant appears to spread faster, but doesn't appear to cause more severe disease. As of January 10th, cases of the UK variant had been confirmed in multiple regions of the United States, so it's making its way over, but none have been found in Alaska. The CDC is monitoring the new variants and encouraging states to do more sequencing. The state's public health laboratories routinely sequence a subset of positive SARS-CoV-2 tests, including all that contain the pattern associated with the UK strain. They then go on to emphasize here that Alaska Health Order 6 requires, this is for travel, at minimum a test within 72 hours before arrival and strict social distancing for 5 days on arrival to Alaska. To help stop new strains of virus like the UK strain from coming to Alaska and spreading, testing 1 to 3 days before travel, staying home for 7 days after travel, and testing again 3 to 5 days after travel, as laid out in the new CDC guidelines, is highly encouraged. Starting January 26th, the CDC will require international travelers to show proof of a negative test from within the last 72 hours on arrival back in the U.S. Next point is Alaskans should get tested immediately at the first sign of any symptoms. Tests work best when obtained promptly after symptoms start. Testing early helps people know if they're positive quickly and helps prompt them to take immediate precautions to minimize the risk of transmitting the virus. Most Alaskans continue to get the virus from a friend, family member, or coworker. Many Alaskans who were diagnosed report that they went to social gatherings, community events, church services, and other social venues while they were contagious, but before they knew they had the virus. Alaskans should avoid indoor gatherings with non-household members, avoid crowds, wear masks when around non-household members, and stay 6 feet away from anyone not in their household. As cases, hospitalizations, and deaths continue to increase across the United States, the safest way to connect with others is electronically. Gatherings with family and friends who don't live with you can increase the chances of getting or spreading COVID-19 or the flu. And then they conclude by reminding everybody there are specific requirements for testing and strict social distancing that will apply to anyone returning to Alaska or traveling between the road and ferry system and smaller communities with Alaska. And that information in detail is at covid19.alaska.gov, which is the state site. So those two sites, again, continue to be important. covid19.alaska.gov for the state, covid19.cityofcordova.net for the local one. And one final point that we talked about with Dr. Sanders, whenever it was, Wednesday, I think. And you can still listen to that report on our YouTube channel, youtube.com/Cordova TV. Some of what creates confusion is when the state maybe makes an announcement like, hey, we're vaccinating everybody 65 and above now. Call and make reservations for it or go to this website or that kind of thing. And then you'll hear that, from our local officials, sort of, no, wait, time out, that doesn't quite apply to us yet. So it's a good idea, according to our local team, to continue to, when you hear something about something that the state is doing, obviously be aware of it, but be prepared to have it not be happening in Cordova necessarily the same way, or maybe it's going to be implemented a little later. And reach out to our local response team. 424-INFO, by the way, is a great way to do that, or that Cordova Prepared email address. So keep using the local site as well as the state site. Anytime there's an announcement, we'll continue to get the pertinent details out through these briefings. Want to offer a big thanks again to all the local folks that are part of Cordova's response, the doctors, the people at the city, emergency response personnel, all still working real hard to keep us in the best position possible. Big thanks to everybody in the public who is taking the steps to keep this from spreading around. When our case counts have gone up, it's been within, confined groups of people where somebody maybe got it and then spread it to some close contacts, but they were able to shut it down pretty quick, so it's not just running willy-nilly through the whole town. And we're continuing to do a good job with that, so that's great. This report, if you missed it and want to hear it, will go up to the YouTube channel, youtube.com/Cordova TV, if it's not up there already. And we will continue to come to you in the 1, 5, and 8 p.m. hours weekdays whenever there's an update, in addition to populating that YouTube channel with these reports. Hope you have a great weekend. Stay safe. Thanks for tuning in, and we'll get back to regular programming on the Clam and the Eagle.